going on with your blood pressure? What's healthy, what isn't, and how can you improve it? Dr. Milady Murphy is here from Shelton State's Health and Wellness Center to tell us more. Dr. Murphy, it's good to see you again.
Always a pleasure, Daniel. Heart disease is the #1 killer in the United States. And high blood pressure is one of the risk factors that accelerates that disease process. You know, there's two things going on, and I'm so glad you wanted this topic today to share with our viewers. With high blood pressure, you have what is called hardening of the arteries or arterial sclerosis, that narrowing, that stiffening of the arteries. You also have what is called atherosclerosis, that plaque buildup. And when those processes go on because of bad lifestyle, blood pressure elevates. So if the viewers out there have got a pen and pencil, we've got 10 good tips that are proven within 3 weeks if someone really wants to reverse the disease process or slow down the progression of this disease, especially as it relates to high blood pressure, they can do so with these tips.
Now, what do we need to do first?
Well, the first one is, you know, and the medical literature is abundant in this area in saying that folks now of all ages need to count the milligrams of salt. And they need to keep it at 1,500 milligrams, especially if someone has congestive heart failure, if someone has a propensity towards hardening of the arteries that's affiliated with salt consumption, that to keep their milligrams of salt at 1,500 calories, so they need to learn to read the labels, because salt is virtually in everything, Danny. So especially in packaged food, processed food, canned foods, read the label, see how many milligrams of salt. You may want to put down that product and choose a healthy alternative.
Now, what else have we got after salt?
Well, you know, and I put this down here, and you know how important it is, and we've talked about you on your show so many times, exercise. Exercise strengthens the muscle contraction of the heart and helps the blood pump more effectively and efficiently through the body. What so many physicians recommend, especially in the area of cardiology, that you exercise 30 minutes a day, 5 days a week. Go for that 150 minutes a week. And break it down any way you want, but exercise seems to have a very powerful effect in not only the contraction phase of the heart, but also as it relates to high blood pressure and reducing that risk.
Now, you said stay away from salt. I'm betting there are some things, though, that you can eat that will help you.
Oh, absolutely. Good job, Daniel. You know, the American Heart Association recommends that we get fruits and vegetables in our diet. Well, there's a reason for that. It has a very positive biochemical response on blood pressure. And it reduces the risk of the narrowing of the arteries, and it reduces the risk of the plaque buildup in the arteries. See, fruits and vegetables are very high in what is called pectin. And pectin has a biochemical response that keeps the arteries more free-flowing, that reduces that bad cholesterol buildup in the arteries. And so more fruits and vegetables in the diet. Now, along those lines, the American Heart Association also recommends the guidelines by the Mediterranean diet and the DASH diet. These diets tell you got to eat to be healthy, you got to eat to lower blood pressure, but they guide you in food choices that are very heart healthy.
Now, a lot of times we'll hear you mentioned exercise. That's lifestyle. Changing your diet, that's lifestyle as well. I'm betting stress. We hear about stress a lot. And sleep as well. Talk to us about
Good points, and we're going to talk about this. You know, they tell you to manage stress. Well, how do you manage stress without quitting your job?
Yeah, really.
You know, the exercise is one of the ways, and we've talked about this. Diaphragmatic breathing has a relaxation on the mind and body connection. Progressive muscle relaxation, we talked about this on this show many times. They use it with the veterans with post-traumatic stress disorder. These types of things that one can easily infuse in their lifestyle can help them to reduce stress while they're keeping their job.
There you go. All right, and then getting enough sleep, too, I'm assuming is a big part.
Yes, American Heart Association recommends, as far as it relates to blood pressure, and heart disease, get at least 6 to 7 hours sleep. The more, the better. Closer towards 8 is very beneficial as it relates to heart disease and hypertension.
So, wow, that's a lot. What have we skipped? What did we miss? What did I forget?
Well, you know, caffeine. They're now talking about caffeine in that some people can have elevated blood pressure for a longer period of time if they consume too many caffeine or caffeinated products, whether it's in coffee, tea, or sodas. So be aware of that. Also, smoking has a negative effect on blood pressure, as does exposure to secondhand smoke. So be aware of those things. And I know it's football season, in moderation, alcohol in moderation, because if it's too much, it has a negative effect on blood pressure.
There you go. 1 glass of red wine, good for blood pressure.
That's what I said, in moderation. Absolutely.
1 bottle of red wine, bad for blood pressure.
It does the opposite.
Is that everything? Did we get it all out?
Yes, sir, we did. And thank you so much for sharing this with our viewers out there. You know, News at 4 has done so much in the area of wellness. I get phone calls from all over the state, folks saying, you know, Dr. Murphy, the information gotten on News at 4 has helped, you know, my health, my lifestyle, made us feel better about ourselves. So you're to be commended on what you have done for the folks out there that watch News.
You make it very easy, Dr. Murphy. I just sit here and listen.
You're so sweet. Always a pleasure.
Thanks for being with us. You can find out more about the Health and Wellness Center online at sheltonstate.edu or by calling 205-391-2994.